Today, we've heard from several national leaders. You can't get really more national than some of the leaders we've heard from today, particularly Jim. We've heard from some of our regional leaders. We've heard obviously from our health innovation networks, crucially. We've heard from our innovators. We've heard from patients. We've heard from frontline clinicians and managers. We've heard from ecosystem facilitators and many more people. I think some of the themes we've heard today, we've heard a lot about what makes success work. What are the secret ingredients behind the successes? We've also heard quite a lot of honesty about, where things haven't worked, what the lessons learned has to be. But I think one of the things we've very, very much heard is innovation is absolutely a team sport. And that's what this final session is about. We all have a role to play. So we really wanted to bring the government in the form of Ros and our HINs, our frontline leadership, our ecosystem facilitators and our innovators together to talk particularly about how do we ensure that alignment works. When has it, give us examples of when it's worked before, and let's think about how we can do more to join the dots in the future. So before we get into the debate, I just want to ask the panel to briefly introduce themselves and just give us a little bit about who you are, but crucially, I think, just add a flavour to, I suppose, your starting position statements on this world of alignment, all the way from national to frontline and back up again. And shall we start at the other end with Andrew?
Yeah, sure. Great, thanks, Richard. So I'm Andrew Edmunds. I'm the Innovation Director in Northumbria Healthcare. We are acute community primary care services across Northumberland and North Tyneside. Our old boss is now the boss, which brings both benefits and risks, I should say. And I guess we have a range of different, innovative arms. It ranges from, I think, something closer towards the higher end to something that is a bit more, further away from the higher end. I don't want to call it the lower end, but that includes some of our commercial activities as well. And I think Jim said it earlier, and we'll maybe get into it a little bit in the discussion. Everyone has got a role to play. There are some common themes, I think, within that in terms of pushing forward the risk appetite, in terms of making decisions that potentially feel a bit more risky. And quite a lot of the time, I see Nick's in the front row, and actually we're talking about the same company in the same way, or the same partner in the same way. But there's also loads of examples where that's not the case, and there might be really good reasons for that. But I think it's just about being honest and actually working out where that reason is. It's a real reason rather than something that just comes from, I'm a bit pissed off with Nick this week or something like that. So, that's where I am.
Thanks, Andrew, for that. Let's move down to Ben.
Thanks. So I'm Ben Bridgewater. I'm the Chief Executive at Health Innovation Manchester. So we are very proud to be a member of the Health Innovation Network, very proud to be a member of the Northern Health Innovation Network. But we're also a wider partnership between local government, the universities in Greater Manchester, industry and the NHS. And we work hard to try and understand what's going on in terms of national policy, but also try and understand what's going on with respect to local policy, and particularly how the devolution agenda, which is long and deep in Greater Manchester, is creating opportunities for local people. So a lot of the challenges that I have, which makes my job particularly interesting, I think, and is the reason why I have no hair left at all, is we're trying to actually bring together those policies which come out from the centre and make them make sense at the local level to add benefit to patients, citizens, the Greater Manchester economy, and ensure that the Greater Manchester economy punches its weight in terms of contributing to UK PLC. And actually it's that alignment which is some of the hard stuff, and I do think that we can probably do it better if we get our heads around it properly.
Yeah, thanks, Ben. Ram?
Hi everyone, my name is Ram Rajaraman. I'm the Healthcare and Life Sciences Lead for Quantexa. So I know one of our founders was on the panel before, but as a reminder, we are a British scale-up. So we link and contextualize complex siloed data at scale to create effectively a patient or a citizen 360 to drive better decisions. I've been lucky to be part of a number of innovations, some successful and some not, in the NHS over the last 2 decades. Used to head up GE Healthcare's Command Center business, which is up and running in Bradford Teaching Hospital, driving real-time predictive patient intelligence there. Also worked with NHS England on the FTP, on Palantir, on their System Coordination Center a few years ago, and hopefully driving some more innovation through Quantexa. So in this conversation, hopefully what I want to kind of drive out is four ingredients, I would say, helps and supports innovation when policy, the problem statement, clinical sponsorship, and data, when all those four come together in harmony, it's I think where the true magic happens.
Thanks, Ram. Nathan.
Hello everyone, I'm Nathan Berry. I'm the Head of Collaboration and Health Tech Lead at Nexus, which is the innovation community at the University of Leeds. So we have about 130 members of that community, of which over half, about 60 to 70, so roughly half, are within the health tech space. And my role, my team's role, is to work with them, understand their challenges, and help them navigate the complex landscapes that exist, not just into the NHS, but for these companies, even though we're based at the University of Leeds, only about 15% are spin outs. The rest are all companies that have come to the university, come to the region to say, how do we access the skills and the expertise? So when we look at it in that respect, it's into the university as well as into the NHS. Prior to joining the universities, I worked for a small company, so I understand the challenges of finding the right person. And I think that's when we talk about policy and the announcements and where they come from central government. Sometimes they're not the policy announcements, but there's no detail behind it. But the innovators, they hear them, they come to us, and they say, right, how do we get in there? How do we solve this? We've got a technology to solve this. And then there's a frustration there because the local NHS, they see the local NHS as the barrier, but the NHS, the services are still trying to get their heads around what these policy announcements mean, how they deal with them, how they service the patients. So how we smooth out some of those bumps in the road, I think, is something I'd like to get my head around.
Brilliant, thanks Nathan. And finally, Ros.
Good to see you all. I'm Ros Campion. I'm the Director of the Office for Life Sciences, which is a trilateral unit in the UK government. So we report into the Department for Health, the Department for Science, and the Department for Business. What I think that means, having heard everybody on this panel, is that I'm the bad guy, which was really not the pitch I was told.
No, that's you.
And I find deeply upsetting. And Ben, I thought we were friends, but apparently no longer. But anyway, but in terms of sort of my sort of take on this, so I of course recognise some of the picture that's been set out already, and for me, the key thing that needs to happen is to get the right sort of push and pull between the systems. So as we looked at doing our work to develop the life sciences sector plan and the 10-year health plan, this wasn't a sort of some random person in ivory tower sort of coming up with their own ideas. Like, we did all of the policy work within task and finish groups, which involved many sort of people from industry, many people from the NHS, many people from the HINS. In fact, John Siddall from Cornwall and the Southwest chaired one of our groups. So for me, there is something about making sure that we get the co-creation right, because otherwise you will have slightly bonkers things coming out. And then I think the second thing for me is really making sure that we are listening to the demand signals that are coming out from the front line as much as, listening to those within government rather than sort of being too sort of push. So those are sort of two things from my perspective.
Thank you, Ros. And staying with the bad guy, no, staying with Ros for a second. Actually, you're definitely not the bad guy, by the way. You're an absolute hero for us in terms of innovation adoption. But this is a two-way conversation. This is absolutely not a conversation about how the front line sends a message to the national to say this is what we need to happen better. There's also, I think, a very clear conversation about what is it that we can be doing better from our regional and frontline level to help governments, wider government, not just OLS, in policy formation. So you talked a little bit about the structure you put in place for the 10-year health plan, for the life science sector plan. If you could wave that wand, what would you wish to see, hear, engage with at frontline level that would make your job easier to spread innovation?
So maybe a couple of thoughts on that. So, I mean, the first, and somebody referred to this earlier, like you can end up in a world where policy gets set in London and then it feels like there's a gap and everybody's like, gosh, like how do we fill it? So one of the, and I'm very conscious of that as a risk, and so one of the things that we did with the Life Sciences Sector Plan was to be really clear about what good would look like, who the SROs were, and then to give one person accountability for, you are going to go and do this, but we expect you to do it with the system, not to the system. So in part there is, for me, I hope we've set up our system in a way that policies and the policy pull through from the Life Sciences Sector Plan will be starting from a place of clarity on what good will look like, but also clarity on partnership in terms of pulling through. And a decent example of that is in one of the initiatives that we included, the regional health innovation zones, where absolutely the policy is not sort of nailed down. This is about a concept of giving sort of greater freedom at a local level, permission to break all the rules, to be able to help get innovation pull through, and that is something that we only can do in partnership with all of you in policy development, because frankly you are the people who know what the rules are that need to be broken. So if I could wave a magic wand, it is partly what I have I hope I've set in train. But I think the other thing, and Ben and I were talking about this just before this session, is hearing sort of like an even louder voice into government on what you think, where you think we should be really prioritising, where you think the focus should be. There was a slightly dispiriting moment where Ben said sometimes the steers come through and they're a bit bonkers, and I was like, not the ones that we put out, surely, as my heart sort of slowly broke. But like really, indeed quickly broke, let's be honest. But like really sort of making sure that we are having an honest dialogue, because like there's no, the worst thing in the world is some rando in government comes up with an idea and you don't say that's a terrible idea, don't do it. So be a bit more demanding of us and a bit more open and honest.
That's really good, Ross. Thank you. I was at the launch of our local growth plan for South Yorkshire last week, and I can't remember who was talking about it, but the old joke of, the worst words to hear are, I'm here from government, I'm here to help. Was a pun, I think it was the mayor who used it as a punchline. Not about OLS, absolutely not. I feel we should come to Ben.
I'm just like, what is this? You
I think that's...
thank you for my support group in the front.
Yeah. Help me out, Ben.
I know. I think it is right that you come to me now. So, can I fully and formally and humbly, if in any way I've upset Ros in terms of my opening statement, I regret it deeply, and it wasn't what I meant. But what I would also say in this, and I think this is the kind of key point, is if you look at some of the things that we are most proud of in Greater Manchester, it's when there has been absolute alignment between what Ros and her team are trying to achieve and what we are trying to achieve. And actually, there is inherently a friction sometimes between having a deep devolution agenda and having stuff that gets run from the centre. And the way you get around that is you talk about it and you find a way through. But we've got a number now of absolutely fantastic examples. Some of the things that we've pursued and actually OLS have really come in behind and we've got them over the line. And these are not small things, these are massive big ticket items. Some of the things that actually OLS have done, and they've asked for our help, and we've given a little bit, just little bit of a shove at the end to help it get over the line. Again, big ticket items. Some of the things that OLS have just done, and we go, wow, that's fantastic. And I think there's otherwise some of the stuff that we've done, vice versa. But it does work well. But I think my point is, to actually get those synergies, you've actually got to work at it and recognizing you've got to have the conversations. There is inherently a tension that you work those tensions through. But the more you align the priorities, the bigger prizes you can get and the quicker that you can get them. And again, I formally apologise if that didn't come through in my opening statement.
And Ben, now we've finished making fun of Ros. I was hoping that you and Ros, between you, could just tell us a little bit about the story of some of that alignment through the Eli Lilly journey, if possible. Maybe start with you, Ben, and then maybe Ros can add, but I think that's a great example of how, when it works well.
Yeah, thanks. So I don't think you had to be Nostradamus 4 years ago to work out there were some new therapies coming over the line, which were going to be big ticket items in driving population health. And we did a horizon scan. We have some data assets that we spent a long time building, which we think are really kind of relevant to the global life sciences industry. We have some other things that we do, which we also think are relevant to the global life sciences industry, particularly about pathway reimagining. So we looked at who's got a rich pipeline, who's got a culture that we think is compatible, where might there be some big opportunities, and we started to work on this a long time ago to try and build the opportunity for the future. And we have some fantastic team, and two of them in the front, and we have a methodology, understand, reimagine, implement. And so we wanted to understand the obesity problem. So we worked with Eli Lilly to properly understand the obesity problem. Who's got it? What are the trends? How is that segmented by this, that, and the other? Number one. Number two, what are the existing obesity pathways? Who are they provided for? Are they effective? What's their geographical scope? What's their capacity? And then thirdly, what are the economic consequences of obesity? So we really built that understand a landscape in partnership, co-created with our colleagues at Eli Lilly. We then said, okay, the next step in that is then reimagine how you're going to do things differently. And actually out of that fell the fact that actually there was some further real world evidence stuff that was required, which actually we are quite well configured to be able to do in Greater Manchester. And they were looking for a place with a public policy around obesity, a public player model, a place with mature data assets and some people who could deliver some stuff. And they kind of ended up landing the trial with us. I can say this, can't I, without getting in problems with compliance. So that was my story on that. But actually, a lot through the great work of Jay Hamilton, sitting in the front row here as an absolute superstar. She was developing all these relationships into OLS, and in parallel, but absolutely connected that, there was a whole bunch of work with Rosalind team which came together, and it was those coming together which got everything over the line at the end. Hand over to you, Ros.
I mean, you have told the story very beautifully. I mean, we also spotted obesity was going to be the thing. Great minds think alike. And had also been, we'd had in the life sciences vision, so the previous government strategy, we'd said we want to take a sort of fairly radical approach to a few different disease areas, one of which was obesity, bring together government, industry, the NHS to try and look at solving them differently. And of course, for obesity, we could tell that the real problem was not going to be the invention of medicines because they've been invented, but was going to be how you actually give them to patients. So we had been working with our externally appointed chair, had been brewing up conversations with all the companies who are in the obesity space, and partly inspired by their conversation with Manchester, we then began a sort of broader conversation about the partnership, the broader partnership that we could have, and this ended up with what was a very nice sort of limbed partnership, which had the Manchester trial as a core component, but also a broader national programme run via Innovate, which is I think still open at the moment, which is about testing how to give obesity medicines to patients safely on the NHS. So this is a sort of total package then I think became a partnership that Lilly couldn't resist. And I would say that I don't think that either element, well, my personal view is that neither element would have necessarily got over the line without the other bit. And I mean, I should say, since this is probably one of the last times I'll see Jay, that Jay has done, and indeed Ben and team, but have done such a fantastic job from an OLS perspective, and you have such a large number of fans in my organisation. It's super sweet. But like it is sort of the epitome of demand signalling, horizon scanning, and then partnership, which frankly is what we need to do if we wish to align and accelerate.
Yeah, brilliant. Thank you both. Andrew, can I come to you, please? We heard from your old boss and new boss, I guess, Jim, earlier today, about the lack of bandwidth in operational management. You know, obvious statement, but worth saying. As an innovation leader in the trust, I guess just what is the ratio almost of, I suppose, your attention to build it right here versus look out and look up about what else is happening out there which may be useful? You know, where do you put your time?
Yeah.
And also not just your time, but the time of your clinical entrepreneurs, innovators, others within the trust.
Yeah. I mean, it's tricky, and I guess there are, you know, these things slightly go in cycles over the year. If you try to have a conversation with anyone clinical in December, January, and February, It's not going to go very far, understandably so as well, I think. I think, and you know, I look at our innovation team, as it were. There's 3 people in the trust who have innovation in their title. Most of them have other things attached to it as well. So there's even a kind of ring fencing issue within people who, you know, are there to focus on innovation. I sort of feel like we try and focus on 2 things. One is the funnel. How are we funneling in the right ideas? And some of them could be things that we've developed, you know, internally within within our people. And some of them will, of course, be external. And then there's the pathway about how do we make that, you know, happen, and how do we take it forward. We try not to use the word process because it sort of turns people off a little bit. I think that a lot of the time, and look, there's alignment across organisations, but there's also alignment within organisations across professions. I was at our senior nursing group last Thursday. They're all lovely, but they still have some pretty tricky questions if you want to extend something and roll it out, and it's got anything to do with care, rightly so, especially if it includes some form of technology that's new and a little bit different. So people's risk appetites within the organisation and across the professions will be very different as well. We do try and, you know, create, I guess, and it always sounds a bit naff, but that sort of rising tide, and actually you're able to convince and, you know, turn people into, you know, a net adopter, a net promoter, and take that forward. I think when it comes to between organisations, and I don't know whether it necessarily fitted within the Eli Lilly example, but often, and I was maybe thinking about it in Tony's session, Tony and the entrepreneurs, there's something about where the risk sits, so who the contracting organisation is. We don't think about this a lot, but if something, God forbid, something goes wrong, like who's going to prison, basically, and a lot of the time it's colleagues towards the front line, and that's why the risk appetite is there from big, you know, to start with. And I do think if there's something about like stretching that out or sharing that, and you know, taking that ultimate risk between the organisations across HINs with national bodies as well. I think that's where actually we would improve some of that alignment. It's hard to do, and ultimately a contract has to land with a particular organisation, especially if obviously if it's an external partnership. But yeah, we think about prison more than others potentially.
Yeah, no, quite rightly. Nathan, I'll come to you. I thought you had a really interesting point in your opening kind of gambit around this notion of the signal from the centre, the flare from Whitehall, how you want to describe it, goes up. So, you know, we're all doing, you know, neighbourhood health now, or, you know, the 3 shifts, what it may be. Absolutely the right policy direction to set, and yet the system hasn't really been readied and pitch rolled, and yet the flood of innovations and innovators who get really excited by that because they genuinely believe they've got something to help comes to us, they come to you. I was just really struck by your point about, you know, how do we get that kind of staging better aligned and timed so that actually the system is ready for the innovations as they come forward, and it feels like you're almost holding back a horde of eager innovators who've got something to do, something to say about the problems that government have said they're really interested in. You know, what would make life easier from your perspective in terms of that problem that you set out?
I think we'd use the example of Eli Lilly as the demand signalling. I think for pharmaceuticals, there is, you know what's coming down the line 5-8 years in advance because they publicise information, you can find that information. With tech solutions, with health tech, med tech, there's not that same demand signalling. We can't map it as successfully, I don't think, yet. And so people have ideas, but they're based on what the problem is now, whereas pharmaceutical companies, not only are they a brand name that people recognise, so they get traction through that, they have a lot of access to what the needs of society are, the health economics, the different change in the population health changes that small companies don't. And I think I'm sat here looking at it and thinking it's great to say that we signal this and we've got the support and we can do health economics and look at the demand and say, right, obesity is going to be the problem. But when it comes to a small company, they don't have the same luxury of that. So when I'm sat here, I'm thinking I'm representing the 70 companies that I've got, and to find a clinical champion, to find someone who can help with the population health data, to then fund it and build all that in, is a huge challenge for a startup and a scale-up. And I keep looking over at Rory. Sorry, Rory, for calling you out. I had a company join us a couple of years ago now, and I was just saying to Rory earlier, if it hadn't been for them being signposted to us, coming through the system, and me knowing that I could email Rory and say, look, there's this company, this is what they're trying to solve. Can you give me any advice? And he said, don't send them anywhere else, I want them. And it would have taken them 12, 18 months to work through the system to find the answer, to find that person. And that is one of the biggest challenges, not just when the messaging comes out from government, but these people with the ideas, how do they navigate that system? And if there's no help there, then it becomes a real barrier, and we will lose innovation. I used to work outside the NHS, and I think if I had at a pharma company, other pharmaceutical companies are available, on my email address, I'd have got a lot more traction in the small startup I worked for, getting through the door, and I think that's one of the biggest challenges faced by the innovators.
Thanks, Nathan. Roger, do you want to come in on that?
Yeah, I mean, I thought it was, I agreed with loads that you said there. I thought it was incredibly interesting. I think we are, kidding ourselves if we don't sort of recognise that serendipity plays an unfortunately large sort of role in whether an innovation is successful or not. And in my view, you can take that in sort of one of two ways. You can say, dear God, that's terrible. We need to make sure that we're taking a system-wide approach that is really finding ways of ushering in the right technologies into the system. Or we can say, that is the way of the world. Let us make sure that we are as well networked and as well understanding of the system as we can, so that we can make those connections. And of course, unsurprisingly, I think both of those are the right answer. Like, I absolutely think we need to have a much better approach to supporting innovations more generally. That is why you see our system, their government is putting more investment, more focus into things like the Innovate programs, the clinical, like all of the systems that we put in place. But like, serendipity will always play a role, and I think it is really incumbent on all of us to make sure that we are sort of helping serendipity work, right? So sort of a different example of a partnership that we forged in OLS was with Oxford Nanopore. And that was definitely a serendipity thing where I sort of put together that we had a sort of set of concerns around pandemic preparedness and surveillance from a sort of government perspective, and I had a UK company that really could do with selling their stuff, like proving that their technology worked in the NHS in ICUs. Finding a way of sort of bringing those sort of two things together has now meant that we have a national sort of rollout at an R&D basis, which is like quite something. So don't underestimate serendipity, although it's a shame that is always going to be a part of the answer.
Thanks, Ross. Ram, if we can come to you as an innovator, as somebody who works within the life science ecosystem. Where's your North Star here? Are you somebody who sits there waiting for the policies to drop, as it were? Are you more interested in the customer in front of you and what their kind of local needs are? Is there a mixture of the two? How do you navigate this?
Yeah, no, it's a good question, right? So there's I reflect on, I guess, the landscape in terms of two types of solutions that I'm seeing there. You have the horizontal kind of technology-led solution that's almost use case agnostic. Then you have the really point solutions, technology enabled, but very focused on like a clinical pathway effectively. And where we are focused on effectively is we have a bit of both as Quantexa. We have the horizontal solution that can be applicable to use cases, there are multiple use cases, and we can also focus very much on that. The policy landscape kind of lends at the moment effectively to where some of those various acronyms that are coming out on back of a large kind of data platforms and so on and so forth are very much broad horizontal use case agnostic to a certain degree. But I think where I feel the most impact will be had in the immediate term with longer term scalability effectively is in those point solutions, very much driven by that. We heard a lot about essentially in the morning sessions and panels about kind of redesigning the pathways effectively, like ripping it to shreds and redesigning it from the bottom up. And I think for that to happen, we do need to really be crystal focused on those problem statements I mentioned before. And I guess the experience, I can draw on my experience in a kind of like an opposite reaction to, I think, what Nathan, you said. So before I joined Quantexa, I had my own startup, and I actually felt like I had a deeper understanding of the funding streams, the problem statements effectively they are trying to solve effectively, and the route to scalability, but I struggled to enact that. Whereas sitting on the other side effectively, where we have a larger organization effectively, more doors are being opened effectively, but we're almost being forced into that side of big policy landscape effectively, and almost forcing ourselves into that focused area effectively to be able to have the maximum impact, if that makes sense. So it's a bit of a, so where are we focused on, to answer your question effectively? We're trying to be that foundational, at least Quantexa are trying to be that foundational data layer that effectively drives change at the end of the day. And so we're certainly kind of keeping an eye on the landscape, on the policy landscape, in order for us to kind of ensure that we maximize our impact to the NHS. But the reality is we are very much ingrained in local innovation. So we're ingrained in Liverpool at the moment, effectively looking at vulnerable children, as I think one of our founder mentioned, and we're scaling from local to national with a view to effectively aligning to the policy landscape.
Thanks so much, Ram. Maybe time for 1-2 questions, but that's all because we are short of time. So let's just take one from the centre here. Any quick second hands? Okay, one second hand over here as well. Thank you. Those 2 questions, then we'll wrap up.
Hi, panel. Thank you very much for your responses and your chat today. My name's Lucy Williams. I work at Durham University, and I work as a partnership manager with my local NHS trust of County Durham and Darlington. I was wondering what the panel think about the fact that we have so many different foundation trusts, acute and also those who support mental health and the like, how they all do innovation and research differently. What can we do to generalise this? Because the structure that Andrew has in Northumbria is very different to the structure of the trust that I specialise and work in, as we do with other partner NHS trusts that we work in at Durham. And this is just around health and life sciences. What can we do to try and generalise this? What can we do to support the trusts to help them have a common approach? Because every trust that you go to has got a different management setup. They've got different routes of funding. They've got different sizes of teams. And it would be really great if we could, for us innovators through the universities, if we can find a common approach we can take with our NHS partners. Because there's stuff that we've seen in the Darcy report, I just went through and went, right, that's computer science, that's psychology, that's sports science. And every single challenge that he had, I knew that we could deliver a solution in collaboration. But it's making sure that they've got the headspace that everybody talks about, that they've got the capacity of staff, and that they're not hindered by cash flow by headcount limitations to bring in collaboration. So I'd be really interested to see what your thoughts are.
Thank you. Standardisation of innovation, capacity and capability. Let's take Ros and Andrew on that one.
Thanks. So I completely recognise the problem that you're setting out. I think two reflections from me. So you will have heard from the government sort of very strong enthusiasm for not telling the local system how to do it. And so I think, like, being a very practical person, I would say that it is unlikely that we'll be in a world where we'll suddenly see government in a top-down fashion saying, this is how you should structure things, this is how you should build in the capacity, this is what the headcount should look like. However, what I do see, and to sort of take it to a sort of slightly more hopeful space for you, is a real thoughtfulness from the political teams in DHSC and indeed from the senior leadership in thinking about how do you make sure that you are ensuring that research, innovation, life sciences has the right level of priority across the totality of the NHS, that there are not some trusts, some ICBs that are sort of really prioritising and others that are not. Minister Ahmed, who has recently been appointed, has sort of really sort of strong passions on this subject. So I suspect where we should, and I hope will go, is a world of saying, this is what we think good will look like, now you go and do it. Which is not exactly the answer you want, but I think will mean that the outcomes should end up in a better, more what you want.
Thanks, Bob. Andrew?
Yes, it's a great question, and there will be that variation between organisations. There's at least 2 or 3 colleagues in the room from different organisations across North East and North Cumbria who have a different setup. It is partly the fact of life. I think it's also partly where health innovation networks are the answer, because they can help to ensure against exactly that variation and support us and help us fill in the gaps. And we get something from it, and I do believe that external partners get something from that as well.
Thank you for that question. Right, last question of the day.
Thank you. My name is Daniel Walsh, and from my accent you'll know that I'm not from these parts. But I've travelled from London today, and I must start by saying, Richard, you and the team have done an incredible job. So incredible, in fact, we've spoken very briefly. I have decided to start investigating relocating my company to God's own country, which is what I affectionately refer to Yorkshire. And we're going to do that, and do that very, very quickly. I did want to ask, will we get copies of the presentation slides after the event, Richard?
Excellent question, Daniel. Helen's nodding at me. Yes, we will. Nev, that's a metric. Write it down. Thank you, Daniel.
Again, a hearty congratulations to you and the team. You've done a brilliant job, and I'm afraid you might just be stuck with me.
Brilliant, Daniel. Thank you so much. That's such a lovely way to end. Thank you so much for that. We are out of time, and I'm conscious that Nick and Dean are about to wrap us up. But it would be ridiculous to miss this opportunity just to embarrass Ros one more time. Ros alluded to the fact that she won't be in this role for much longer. She's moving on to pastures new, and she'll do incredibly well there too. You may not have heard of Ros before today. I mean, many of you will have done, but a quietly impactful leader who has worked behind the scenes relentlessly for a number of years on our agenda and numerous agendas driving life sciences across the UK, and done so in a very humble way. She's a huge and hugely supportive supporter of us as health innovation networks and academic health networks beforehand, and that support simply cannot be underestimated. So we are incredibly grateful, and we're incredibly humbled by everything that Ros has done for us and how she's championed us as an entity, our sustainability, our future across government with many, many ministers, past and present. Obviously, best of luck in your new role, but you'll be hugely missed. And on behalf of all of us at every single Health Innovation Network, thank you for everything you've done, Ros.
That's incredibly kind, although I should say that I think it's also the first time I've ever been described as quietly impactful. So I'll take 50% of it anyway. You're right, I have been a sort of constant champion of the Health Innovation Network, and that is only for one reason. I can see that it makes a real difference. And to be honest, I'm a bit weary of people, I say this as I'm about to leave government, weary of people wanting to meddle with things that work really well rather than just letting them succeed. So the thing that I have been really, really keen on doing and have hopefully sort of, helped to solidify is the health innovation networks do not need to be meddled with. They need to be allowed to get on with their job and to work out how they can maximise your potential, because you are awesome. The second thing to say is that I'm off to be the CEO of the Academy of Medical Sciences. So life sciences will remain sort of at the heart of everything that I would do. My absolute intention is to take that job and turn us into, as an organisation, an engine of growth. And as you will have gathered from my first comment, you know that I know where growth comes from. So you will inevitably be seeing me again in a different guise, and I will work on the quietly impactful.
Thank you, Ros. Thank you, and can I thank the rest of the panel as well.